Let me first start off by saying I am so sorry that you're going through this. The way that doctors and medical professionals in general treat women with PCOS is terrible. Oftentimes, they see PCOS as being an infertility disease that only needs to be managed when you're ready to have children. The same thing happened to me when I was first essentially dealing with the symptoms of PCOS. I obviously don't know your personal situation, but I'll tell you mine. I was 13 years old and I was struggling with extremely heavy periods. Like I was having to get my iron levels checked because the fear was I was losing so much blood so often throughout the month that there was a risk that I was going to become anemic or sick because of it. And then I would go months and not have a period because I was growing very large cysts on my ovaries. One cyst became so large, it was actually the size of an orange. And because it was so large in my body, it was actually pressing up against the nerve endings in my hip and shooting down pain in my leg. I was supposed to have surgery, but they put me on a bunch of hormones that basically force your body to drop the cyst in a more predictable way versus having it rupture, because having a cyst rupture is potentially dangerous. My body dropped the cyst, and let me just tell you, it was so painful, like top 5 worst pain of my life. I actually passed out from the pain. Like that's how bad it was. So I actually went to my doctor with my dad, and he was helping to advocate for me at a young age and basically saying, "Look, my daughter struggles with her weight. She eats very well. I'm her parent. I know what I'm making her for food, and I'm seeing her eat. She doesn't eat a lot of calories. She eats very well. She's on travel volleyball, she's on travel soccer. She is very, very active, but she struggles with her weight. Also, we don't really have a lot of like genetic issues in our family that would disposition her towards obesity, so it doesn't quite make sense. It's not a genetic issue, but she also has black hairs on her stomach. She has it on her hands and on her face, and that's unusual. Her mother doesn't have those types of things. It's seeming like she has testosterone in her body, which would make sense if she has PCOS. And the doctor was like, "You might have PCOS, but you also might grow out of it. And here's birth control. And let's talk when you want to have children." And sure enough, when I was 25 years old trying to get pregnant, I couldn't. And then my doctors decided to treat my PCOS. After I was done having children, they were still like, "Why do you need metformin?" Which, if you're new here, metformin is a diabetes medication, and that is the standard of treatment for women with PCOS right now. And I'm like, because I have insulin resistance, I need to be on medication like this. Lucky for me, my OBGYN actually has PCOS. And so she and struggled with her weight. So she was like, "Obviously, you're going to stay on metformin. Like, you need it." And my primary supports me being on it as well, because obviously I've lost a lot of weight. And of course, he supports me on being on Manjaro as well, which is also a diabetes medication, which I really hope becomes the standard of care with women with PCOS. I want to give you some advice, but I also recognize I don't know your personal situation and I don't know your ability to access certain doctors or your health insurance or things like that. So just please note that I understand that what I say is not always easy to actually put into motion. But I really want you to advocate for yourself. PCOS is not a infertility disease. PCOS is a much larger metabolic disorder, and infertility is a symptom of the true underlying issue. So, because I don't know your exact situation, what I would suggest is like OBGYNs to me is considered a preventative doctor. So, I don't have to get a referral to go to an OBGYN. I highly recommend that you continue to find a doctor, try to find a doctor, try to get into an OBGYN without needing a referral if that's possible in your area, or find a different provider that will give you a referral to OBGYN. Also, you can go to an OBGYN for things other than PCOS. So if you need a referral for just to go to the OBGYN to talk about birth control or whatever thing you say you want just to get in the door, I would totally do that. And then go into the doctor and talk about whatever you want to talk about. Of course, again, this is just my opinion. I don't know your situation. But I wish you all the best of luck, and I really just hope that you know that you are worthy and you should advocate for yourself the best that you can. I obviously understand that there's things that restrict us from being able to do those types of things, but I wish you all the best, and feel free to DM me if you need any advice. I'm always here to support my sisters. Bye.